day, ladies and gentlemen. My name is Nicola. I am your host, and welcome to the show today. This is Who We Are, and I'm so glad that you have joined us. Who We Are is a show that showcases multi-talented and multifaceted women. These are women who have committed their lives to seeking excellence in every area, in their families, their careers, and their businesses. They are women who are living a purpose-driven life and are letting their light shine for their generation. Today, I have the pleasure of introducing to you two wonderful ladies here, and we have a wealth of information to share with you today. Actually, today's show is going to be a little different in that we're talking about a problem that affects a lot of women today. We're actually talking about preterm labor and birth. I have the pleasure today of introducing to you Bridget Chapital. She's actually my twin sister, just in case anyone was wondering. I think they might look a little alike, but she is a health education professional with close to 2 decades of experience in the medical research industry. She also has a master's degree in health education and administration. And Bridget is the founder and the current director of Hypothesis Haven Science Club, and it's a health science program for young children. So please welcome her to the show.
Thank you. Glad to be here.
Thank you. Thank you for joining us, Bridget. I also would like to introduce to you Andria Lee. She's a nurse, an RN. She has a master's of science in nursing and also a master's degree in health education and administration. She's an OB nurse, a school nurse, and a nursing professor. Andrea, welcome to the show today.
Thank you. Thank you for having us.
Thank you, ladies, for coming. This promises to be an informational show. What we aim to do as educators and as nurses is to teach people. There is a gap when it comes to patients and the people that take care of them. And that's a gap that we're trying to close, because anytime you enter into the healthcare industry as a patient, you need to come armed with knowledge. Like scripture says, wisdom is the principal thing. Get understanding, get knowledge in anything that you do. And that is our goal here today, is to equip you so that you as a pregnant woman, whether it's your first, second, or even third, to equip you with the knowledge that you need to bring a healthy, full-term baby into this world, and also to stay healthy yourself. That's always the goal every time you enter into the healthcare field, right, ladies? Would you agree?
Agree.
So we actually are mothers ourselves. We come with a wealth of knowledge in our backgrounds and also in our personal lives. I, as you all know, am a mother of 3, and Andrea also is a mother of 3, and so is Bridget. We all have young baby. Well, you have the youngest. How old is your baby?
17 months.
He's a little one, and then they go up to 6,
Almost
7,
10.
10. Our oldest are almost 10. So when we talk about preterm labor and preterm birth, a pregnancy is usually anywhere from 37 to 40 weeks. That's what it should be. Anywhere from 37 weeks on is considered full term. So when we say preterm, we're talking about babies that are born before 37 weeks. Andrew, what are the incidences today, the statistics of babies that are actually born before 37 weeks?
15 million babies worldwide are born before 37 weeks, and the United States of America is number 6 in preterm births.
Yes, which is actually pretty staggering, right? Because this is a developed country, first world country, and for some reason we still have those disparities and those gaps, and so that shows us we have a lot of work to do. There's a number of factors why some women more than others are leaning toward preterm births. What I do want to focus on a bit today is us as Black women, right? Because this is something that hits close to home for us, and we need to be on the forefront of learning how we can overcome this, and we can do better for the generations to come even.
Well, I was actually going to just piggyback and say, to Andrea's point, the reason that the United States is 6th in the world with preterm labors is directly related to the fact that Black women of African descent in this country have such a high rate of preterm labors.
They do. And the question is, why is that? There are several risk factors that come into play there. I would say the majority of them, according to the research, is socioeconomic factors. There are those factors there, those stresses that are somewhat unique to the Black race, that a lot of other races either don't go through, or if they do, there's more of a support. Would you say that, ladies? More of a
Yes.
support that helps them through some of the stress factors that Black women may not have.
Yes.
And those can carry on. And of course, we know that stress is a major complicating factor of a pregnancy.
Yes.
Will you speak to that a little bit?
Yes. In the Black race, a lot of women are isolated in our culture when it comes to pregnancies, with our spouses, our families, also with health care, having scant health care is another one because of low socioeconomics. So we can't get to the doctor, and they consider under 8 visits to be scant health care. So if you are going to the doctor less than 8 times in your pregnancy, you are high risk for preterm delivery.
That's right. So ladies, the importance there is, as soon as you find out you're pregnant, find a good and qualified medical doctor, an obstetrician, an OBGYN, to start seeing immediately, and follow that schedule. And follow it to a T. And every single visit is important. Every single visit is important. So ladies, let's talk a little bit about the risk factors in general. Okay, so of course, we should all know that smoking is a major risk factor of preterm birth. It causes low oxygenation. Of course, that causes low placental perfusion. That's the perfusion of the oxygen that goes from the mother through the placenta to the baby and back in that loop. And all that is compromised when you smoke. Also, if the mother herself is very overweight or underweight before pregnancy, that plays a risk as well. And as Andrea mentioned, not getting prenatal care, not getting enough. There's also the risk of alcohol and using street drugs during pregnancy, which some people, those are habits that they don't have under control before they get pregnant, and unfortunately carry that into the pregnancy, right? There's medical conditions that mothers experience, such as high blood pressure and preeclampsia, diabetes, blood clotting factors, and infections. And speak a little bit about the blood disorders, the maternal blood disorders.
There's blood clotting disorders we call it MTHFR syndrome, and low vitamin D levels have been prevalent in a lot of African American women that can affect the blood flow to the placenta. So now a lot of high-risk doctors are checking vitamin D levels and blood clotting levels in Black women.
And while we're on the topic of high-risk doctors, if you are someone who does have any of these conditions beforehand, ladies, it's not enough to see a quote-unquote regular obstetrician. You need to seek high-risk doctors, perinatologists, and doctors that focus on risk factors of the mother, and also conditions in the pregnancy of the mother, and then also of the baby themselves. There are actually doctors who specialize in that. And those are the ones that are usually going to be located, maybe if you live in a big city, like here in Houston, in the medical center. Yeah, those are the doctors that you ought to seek out that are well-versed in these, that see these every day, and they don't deal with the quote-unquote common pregnancies. They're the ones that know every single in and out, and those are the ones that you ought to seek if you have any type of underlying condition or a condition that's diagnosed during your pregnancy. Would you agree, ladies?
Yes, definitely. Yeah, I mean, I know in Houston, it's such a big city, and there can be things like traffic that make it difficult to get to appointments, but, I know for myself, and I recommend to anybody that I come across who tells me that they're high risk, that you really try to seek out. I mean, in Houston, we're lucky because we have these, very experienced and sought after doctors, knowledgeable doctors here. It's just definitely gives you a peace of mind to know that you're, in a place where you can seek the kind of care that you need for yourself and your baby. And it's, maybe just a traffic drive away. So
and of course it'll be a drive, but it's going to be well worth a drive, definitely. So don't hesitate to seek out those type of physicians, right? Some of the other risk factors are being pregnant with a baby that has certain birth defects, being pregnant with a baby from in vitro fertilization, that's actually a risk of preterm labor and birth. Being pregnant with twins or other multiples, of course, less space, less room for growth, and those type of things. Also, having a family history of premature labor, and also getting pregnant a little too soon from pregnancy to the next. So all these things are factors that can cause you to have a preterm baby. So these are things that if they pertain to you in any way, be more cognizant of it. And we just want to point those out to you. So, Andrea, let's talk a little bit about the signs and symptoms that people ought to watch out for. As we know, if it's your first, usually you may experience some things you will experience things that are uncomfortable during pregnancy. I mean, we can all attest to that.
Yes.
You're gonna have aches and pains. You're gonna have little backaches. You may even have some spottings. At any point in time, these things are, you have a question on them, definitely we'd advise you to call your OB and discuss. But there are certain things that are not normal during pregnancy and that you need to be on the lookout for. And so let's just kind of get into some of those and discuss some of those.
If you're having contractions and lower back pain that does not ease with rest and fluids, please call your doctor. That could be early contractions. If you are leaking fluid constantly and every time you wipe, please seek your doctor's advice. If you have bleeding, please go in ASAP.
That's right. And just to your point about the fluid leaking, it's actually startling to me how many people don't know that when their water breaks, they're supposed to go to the doctor immediately. I was talking to a friend of mine who, she was full term, but had the leaking and just thought, well, I'm not having any contractions. I'm not in labor, so I think I still should stay home and wait until the contractions start. Not realizing that, I mean, she did know that her water was broken, but it just, for some reason, didn't realize that that is the beginning of labor. And that actually, because what can happen there is infection, right?
Yes.
Your fetus is now exposed to the outside air, which bacteria can now travel through the vaginal canal into the uterus and cause an infection pretty rapidly. They say sometimes in less than 24 hours, right? Yep. Yeah, so of course when you get the fever and infection can set in and that type of thing, and very detrimental to the baby and could be to the mother as well. So any fluid leaking that you are not sure of and it's ongoing, immediately call your doctor and go in, okay? Especially when you're preterm. So what are some of the other preterm labor signs that one ought to watch out for?
Nausea and vomiting, for one, and pressure. So lower pressure that is constant and you just feel like a doom. They say impending doom is what we call it in healthcare. Something's not right. I woke up, I feel different. I'm having a fever. I'm nausea, I'm vomiting, I feel like I have the flu. These are all signs of infection, uterine infection, vaginosis. It could be some sort of infection that will lead to preterm delivery. So if you wake up and feel ill or have pressure, please call the doctor as well.
It's so true. And like I was saying, some people feel like, well, when I'm pregnant anyway, I'm not supposed to feel great 100% of the time. But any feelings like, and I think a lot of that is what they call women's instinct. Thank you. Yes. Women's intuition, mother's instinct. Because you as a mother, as a carrier of life, there are certain things that God has put in you that you're going to just walk into that, and you're going to find yourself, especially with new mothers, just realizing that you know certain things, you're doing certain things out of instinct. Well, that's how God made you, and He's given you that premonition. He's given you that instinct to know that when something is wrong. So follow that. Don't downplay it. You know, it's how He made you, and it's a way to keep yourself and your baby safe. Okay, all right. So ladies, we're going to take a quick break here. We're going to be back to continue to talk about this subject, and we'll see you on the other side of the break. Hey there, and we are back. My name is Nicola, and I am your host, and we have been talking about preterm labor. If you're just tuning in, we have been just having a discussion on some of the risk factors, some of the causes, signs and symptoms, and we're going to get into a little bit about how we can prevent this thing and how we can educate ourselves. We've been talking to Bridget Chapital. She is a she has a master's degree in health education administration, and she has over 2 decades of experience in health research. And also, Andria Lee, she has a master's of science in nursing. She's an RN, has a background in OB nursing, and is a nursing professor and also a school nurse. So welcome back to the show, ladies. So let's pivot a little bit and talk a bit more about ways that we can educate ourselves, about how we can learn what there is to learn, and how we can get ahead of this curve right here with
Well, I would just like to say one of the things that I think is so important to realize, we talked a little bit earlier about a lot of the signs and symptoms that you should look out for if you go to the doctor. And we also talked about some of the characteristics of women that usually have preterm labor. I think the thing that's really important to emphasize is that even though factors like maybe not being as informed, maybe being younger mothers, smokers, just having personal lifestyle choices that may detrimentally affect your child. In this country, again, with African American women, we're constantly seeing people that are highly educated, not smokers, active lifestyles, exercise, eat right, but are still seeming to have a lot of these same problems as women who are maybe not taking as well care of themselves. And so it's really important that for us especially, that we really stay in tune to these factors and don't think that just because I'm healthy and because I'm educated and because I, have health insurance, that I'm not going to have these problems that other women may have that are not in my situation. And so with that, I just think it's so important to be educated about ways that you can put yourself in a position that when you go to the doctor, you're putting yourself in that best position and your baby to have a good outcome that you want.
Certainly, that there is key, because I think the tendency of a lot of health professionals is to assume that you know these things, especially if they know that you are an educated person, college educated or beyond, and but health is a totally different beast, especially if you did not get a degree in health at all, not even to talk of nursing or obstetrics, Norwegian. So you do need to ask those relevant questions, right?
Yes.
You need to come armed with a list of things to ask.
All nurses are not specialized in OB, so even if you're an educated nurse for 20 years, you can still be very lost in your whole process of pregnancy because you're just not experienced in that.
Right. And I think that a lot of people have a tendency when you go to the doctor anyway, like I think there was a commercial that came out recently where the lady's like talking and she's talking about her stocks and bonds, she's talking about this and that, and then in the doctor's like, do you have any questions? And she's like, no. Like I think a lot of us just feel intimidated at the doctor's office and like we can't ask questions. Right. And so on the flip side of that, as health education professionals and medical professionals, I think that certain changes need to take place. For example, at the end of seeing a patient, if a nurse is like, okay, do you have any questions? That kind of puts a lot of pressure on the patient to be like, would you say, what questions do you have?
And
that kind of opens the door and lowers that barrier where the patient can be like, well, I read on Google that this and this, is that normal? I think that there has to be kind of a two-way street, but definitely, as a patient, you can't control what your doctor is going to do, but you can come armed with questions and know that it's your right. And you are more than welcome to sit and ask a laundry list of questions. I mean, I would come with questions written down because in the moment it might be hard and a lot's going on, but just write your questions down ahead of time.
For sure. That
you want to ask your doctor or your nurse when they come into the room. That's one easy way that you can make sure you get all of your things addressed.
Yes, and don't feel like you are taking up too much time or you are stepping on their toes by asking these questions. No, these are actually questions that they have to give you that time. First of all, you pay for this. Your insurance is definitely paying for it. And not only that, your baby's life could be affected if you don't ask those type of questions. They are obligated to ask answer you, and more than happy to. So don't be worried about, she looks like she's in a hurry, or do I have to write them down ahead of time. Nobody can, but I really like what you said about practitioners using that language that says, what questions do you have? Not do you have it. Open-ended questions. And even us as nurses, they taught us in nursing school, ask those open-ended questions, right? And always just be armed that way. I want to talk a little bit about maybe some either experiences that we either saw in the hospital or maybe had ourselves that would kind of highlight some of this and shed some light on it. Is there anything that you kind of wanted to discuss in that light?
Well, I mean, I know me in particular, I actually have had, I have 3 children. I've had 3 C-sections. And I know going into it, I mean, I can remember in my master's dissertation, all my projects are always about elective C-sections that people choose to have, that they don't really need to have them. They want them either for convenience or, because the doctor's going on vacation early, or because they want to go on vacation early. They don't want to be. And I was just I was so staunchly against, I don't want to have a C-section. I want to have, but the circumstances ended up to where with my first pregnancy, my child was, not growing as she should have been in the womb towards the end of my pregnancy. And so my doctor was like, okay, well, we need to induce you. I never went into labor or anything like that. So they had to go ahead and start the induction by breaking my water. And again, as they've mentioned here, once it's been about 24 hours and your water's broken, okay, now we're in a position where we have to, go ahead and move because you're going to get infected. So I had to have a C-section at that point. So that in and of itself was just a whole different, mind frame, because I wasn't expecting it. So with my second pregnancy, going into it, I already knew that I want to try again. I don't want to have another C-section. I want to try to have the baby, vaginally. But, I read up on the risk, myself and my husband, and we saw that there's a 2% chance of, your uterus rupturing when you try to go into labor after having a C-section, because that part where your uterus has been cut, the stitches could burst and you could have a problem. So 2% chance. So we go into the hospital and we're focusing on this, and we're telling the nurses and the doctors and anybody who will listen, okay, so I've had a C-section before. I just want to make sure y'all are ready. And, and we could tell. They're like, okay, all right.
Yeah, okay, why are you guys stressing about this?
Yeah, why are you bringing this up? And so we were met with that. And there's a term for it called cognitive resistance, where the doctors feel as though, okay, well, yeah, okay, fine, sure. You read this on like Google University, or,
Yeah, exactly.
They don't quite take
they kind of
seriously.
Downplay it, yeah.
Yes.
Yeah, and so that was like a big thing for us, but sure enough, that exact thing happened. And, I really strongly believe that had it not been for my husband being there and being an advocate and us being very vocal about the fact that we were concerned about this, that they might have blown it off and, oh, that's not what we think it is, or it could be, so, I mean, I say all that to say that I think it's really important that when you go in, number one, you're your own advocate. You're not afraid to speak up for yourself.
Speak up, be an advocate for yourself.
Because you know your body better than they do. Yes, they have all these years of training, but at the same time, especially as Black women, and I keep coming back to that, sometimes there is this sort of disconnect between yourself and your medical providers, or who you may have a great relationship with your doctor, but they may not be there the day you deliver, depending on schedules. And so it's really important to come in armed and knowing that, we're partners in this process. It's not my doctor's here and I'm here. We're partners, striving towards that same endpoint.
Yeah, great point. I love the fact that you said that we're partners. Yes, don't look at it like they're here and I'm here. This is everybody's goal, your doctors and you, of course you, is to bring a healthy baby into this world. We look at it like that. I love the fact that you said that we're partners in this. And Andrea, what about yourself? What was your experience like?
I also had 3 C-sections like Bridget. My first was because my baby was larger for my frame at the time. I was very small. And my baby, I just never went into labor, so we just went on and scheduled the C-section. The second one, I should have tried for the VBAC, is the word they call it, vaginal birth after cesarean. Yes. But being a nurse, we're in OB, we're just always into that 2%. We don't, even OB nurses, we don't even have baby showers till we're almost delivered, because we're always so nervous for something to happen. But again, everybody's not an OB nurse. So some
Yeah.
women are really positive and say 98% of VBACs work. I'm in the 2%. So I just went on and scheduled my second and third. But no complications, thank goodness, in the pregnancy or postpartum. But definitely be a part of your team. You are in the medical team too. People don't realize that we are part of the medical team as the patient and our families. Your
Yes.
family have an advocate for you, because if you do go downhill quickly, you need that person that's already armed and ready to speak for you.
Oh, certainly. Yes, we can't stress that point enough. At this point, we're going to take another quick break, but we're going to be back and continue the discussion, so stay tuned. Hey there, we are back. Thank you for joining us once again for our last segment of Who We Are. We've been talking about preterm labor and preterm births, and specifically how it affects the African American community and the community at large. As you may know or may not know, preterm birth is the #1 cause of death among newborns in the United States. And it's something that can be prevented most times. And one way that we were kind of talking in the break about ways that we can prevent it and combat it. And we've all pretty much agreed that it's with education, right? You have to be educated. You have to know what the signs and symptoms are. And you also have to know how to deal with those and what you're going to do if XYZ occurs, right? So let's speak to that a little bit. What are some of the reasons, why do you think, Bridget, are some of the reasons why people don't get educated or don't seek out that knowledge?
I mean, I think that it kind of goes back to the part we talked about being a partner in your care. And so I know I've had some friends who have like this long birth plan and they want to have the water birth, they want to be at home. And, you know, I think that while it is important to have a birth experience that is personal to you and that you feel comfortable with, you also have to balance that with education and know, you know, that if you do have certain risk factors, then maybe that home birth is not going to be, you're not the best candidate for that. Or, you know, if you have some other things going on, like maybe you live in an area where the type of hospital or care that you might need if something goes wrong is available, then, you know, I just think it's important to just be flexible in what it is that, you know, you might happen. Yeah, everybody wants that plan A where it goes smoothly and the baby just comes right out. But if it doesn't, you know, then what are we going to do now? And to really kind of push your doctor to go there with you and figure out, you know, what could happen.
Yeah, contingency plan, right? Yeah, because I'm sure you remember. We all know back in our days working in the labor and delivery ward, they come in with a 5-page birth. What did they call the birth plan? This is what I want, and as soon as you saw it, you thought, "Oh my goodness!" Like, "Oh gosh, so this is how this day is going to be." And then you immediately just jump in there with the education, because that is what. And you were even saying that control that some women want to have, that rigidity, is because of a lack of education, right?
Education and not refusing to have a plan B or C. And you need your person that's going to speak for you to know plan B and C as well. Because if you're not doing well and they don't know what to tell the doctors, you know, they're your advocates. Because again, even healthcare providers listen to your advocate and the patient as well. You can't do anything without consent to a patient. So we still listen to the patient support system and the patient.
Yeah, so let's talk specifically about things you need to do and things that what you need to do walking into there, right? So we mentioned this word advocate, somebody who is your helper, right? That's the meaning of the word, somebody who can talk for you and stand for you and who can represent you if in the event you can't speak or stand or represent yourself. And which brings me to the case that happened in California, I believe maybe a year or so ago, right? You guys remember the case where a young lady was having, it wasn't even her first pregnancy, I think it was either second or third, but she actually had delivered her baby, and then her husband noticed postpartum wise, she's there in the room and the nurses were not there, and she started to have a lot of blood filling into her catheter bag, which of course the catheter is where the urine is taken from the bladder and into a bag that collects, for those that don't know. It's supposed to be filled with urine, clear urine, but it was filling with red blood. And as the story goes, he was letting someone know and let the nurses know, and for some reason, I don't know why, they just chose to ignore him or say, oh, we'll get to it, or, which blows my mind, because, we're just thinking, I guess, health professionals, how can, I know myself, there's no way in the world that my patient or her advocate husband or whoever would come to me and say, this is what's happening, and I would blow them away. That in itself is mind blowing, but that's what happened. And got to the point where, unfortunately, this poor young lady passed away because of I don't know if they were overfilled that day or if it was back. I don't know what it was, but how does this kind of thing happen? And the lady was Black. So, it just makes you wonder, why does this thing happen? Why is it so prevalent to us? And, what can we do? One thing I will say, your husbands or whoever you are, please, I don't care if your nurse is not listening to you or not taking your concerns seriously. You call for the charge nurse. You say, I need to speak to charge nurse. Walk yourself up to the desk and say, who is in charge? There's always a charge nurse on the unit. And if she's unavailable or not listening, there's a nursing director. The director of nurses is there on the unit in her office. Go find it, knock on the door. I don't care what you have to do. Yeah. Be vocal.
I think some people are maybe nervous. They're like, okay, well, I don't want to, upset people. There's other people here who might need help, but no, you have the right. And it is unfortunate that squeaky wheel gets the oil. And in this case, I'm sure he did everything he could and it didn't work, but at least you know that you have exhausted all of the options before you, give your loved one a better chance of being, being treated.
Yes. No, for sure. Certainly.
So with my first pregnancy, I never went into labor at all. And so when my second pregnancy came around, again, it was going long. But when I started to have contractions, and this is even me being at 38, 39, literally the weekend that I went into labor, had I not gone into labor, I was going to have a C-section that next Monday. And so even being that far along, when I was having contractions, I still didn't know what a contraction felt like. Right. So I just wonder for people who are earlier in their pregnancies, like before the 37 weeks, what are ways that they would know that, okay, actually what you're feeling is not just discomfort and it's not just
the squeeze and release feeling. So you're going to feel a squeeze and you're going to feel a release, and they're not continuous. So it's going to be a break. If you rest and take fluids and it stops, those are called Braxton Hicks, which are practice contractions your body does. If you're resting, drinking fluids, and you're still getting squeezing and they start to have pain, you need to call because you may be in preterm labor.
But over how long of a period of time?
It doesn't matter about the time, it's about how strong they're getting rest. So if you're resting and they're not
resting is key.
Then I would definitely call. Usually with resting fluids, they go away.
They go away.
And it's okay. It's normal to have Braxton Hicks, especially the more pregnancies you have. It's the ones that don't go away that we're concerned with, is that squeeze and release, squeeze and release.
And you can feel your abdomen, ladies. You just put your hand there and you feel a tightening. And like she said, it doesn't have to be pain, but it's tight, and you literally feel that. But sometimes that can happen because you're dehydrated, so that's why Andria says that we're taking in water, fluids. And then when they dissipate, then, maybe it was a little dehydrated. But if they continue, then they get worse and then they get closer. Doesn't matter if you're turning left or right, changing positions, drinking all the water you can, they're still there. And then some people actually describe them as gas pains. Sometimes people feel like it feels like gas.
The baby's moving with them.
Yes, and so that causes that sensation there. But any type of feeling either cramping or a gas or a squeezing that is not going away over a period of time. I mean, maybe it's been a day of this, or so, or a few hours, but it's sustained over a length of time, and it begins to get closer and hurting, then that's a cause for concern. Let's talk a little bit about the postpartum period too, because it doesn't just end there. After you have your baby, there are some things that you still need to be aware of, especially if you're someone who maybe has PIH, that's pregnancy-induced hypertension, or it could be called preeclampsia, toxemia. Those are all the same name for different names for the same condition, which is high blood pressure. What are some things you would tell your patients before they go home?
Before discharge, fluid in your legs and feet are normal. When you start to have a feeling of fullness in your chest or swelling in your face, please go in. That is definitely a sign of a worsening preeclampsia, and it can go into cardiomyopathy, which is another risk factor, and continue high blood pressure afterward having a baby.
Mm-hmm. So and then how soon does that happen? Like when you get home, you should keep an eye out for that.
It's I would say I've seen it the first 2 weeks.
Okay.
It's when you're most, susceptible to the cardiomyopathy and the the high blood pressure that's sustained during postpartum. Okay. So go in immediately. They'll treat it with diuretics and blood pressure medicines.
Yeah. And that's important because I think a lot of women go home, and even though the woman might have maternity leave, a lot of times the partners or, so if your partner has to go back to work, then maybe you want your mom or your sister or somebody to come check on you and the baby, because you could still have these things, that are gonna, take a downhill turn after the baby is born. I don't think a lot of people really realize that.
Yeah, there's still that period of time where you do need to be closely monitored, and you will in the hospital, but also, at home, like we said, have that advocate and be on the lookout for some of these symptoms too. And I think you were mentioning any swelling above the head is not normal. Of course, you're gonna have swelling in your thighs, your ankles, your feet. That's normal, and that will start to dissipate after you deliver in a few weeks. But that's the swelling here, and then the face is still puffy, and then the swelling above the waist, that is most concerning. Definitely be on the lookout for that. And then, of course, there's always the risk of seizures if it gets too high, if the blood pressure gets high. Yes. So these are the things to kind of look out for and to ask your doctor about.
Yeah. Right. And hemorrhage is another leading cause of death postpartum. So make sure you are definitely checking your pad count too. We're supposed to definitely have bleeding, but when you notice you're changing every 20 minutes or you feeling lightheaded, you have huge clots, please let someone know, because sometimes you may need to go in for a procedure called DNC to get all of those fragments out, or you will continue to bleed. So that's another risk factor: infection, bleeding, and blood pressure. Please make sure you monitor those postpartum as well.
Definitely. Well, we've covered a lot here. I think we've had a very informative conversation. I hope you've learned a lot. Specifically, one thing I would say for myself that I want to really stress to you all is never stop asking questions. Never feel like your question is dumb or you should know better or whatever. Ask questions, be informed.
For me, I would just say that a big thing to me is just that partnership with your medical care team, whether it's your doctor or the nurses, and that from the healthcare provider perspective, don't just assume that because your patient is quiet that they don't have any questions. Really get them to open up and give them an opportunity with the way you phrase things to kind of draw those questions out of them. And then just as far as the mothers, just really making sure that any little concern you have, no matter how big or how small it may be, feel comfortable to bring that up to your doctor, but maybe prepare ahead of time, because we all have gotten in the moment and forgotten. Just prepare those lists ahead of time so that you can have that kind of conversation that you want to have with your doctor.
Nice one. Yeah.
Individualized plan of care. So everybody has their own plan. We don't try to cookie cut it. Every patient is different.
That is right. That is certainly true. Thank you all once again for joining us. This has been Who We Are. We pray that this information that you've received today blesses you. We pray that it helps you. And we are going to have this information in print on our Facebook page. So we'll bullet it out for you so that you can see it all in writing. Feel free to copy it. Feel free to refer to it at any point in time. And I want to thank you again, Andria, for joining us. Bridget, thank you again. This has been wonderful. And we will see you on the next episode of Who We Are. Thank you.